Thank you, Marcus. Well, joining us in the living room now is Rana from CHRISTUS Trinity Mother Francis.
And today she's going to talk to us about October being Breast Cancer Awareness Month and the importance of screenings. Good morning.
Good morning. Good morning. Thanks for having me.
No problem. So how common is breast cancer here in the United States?
We're still seeing the 1 in 8 women are affected by will be diagnosed with breast cancer over their lifetime. 1 in 8.
Yeah, so is this preventable?
It is not preventable.
Okay.
You can still do all the healthy living, the exercise, healthy diet. That helps to prevent any kind of cancer, any kind of illness. But as far as knowing what causes breast cancer and how to prevent it, we're unsure.
We don't really know.
So what role does screening,
play
in all this?
Right. Screening mammograms help to find breast cancer in its earliest stages where it's most treatable. Annual screening mammograms are still very, very important because the earlier you find breast cancer, the better it's treated, the less invasive therapies that you'll have, and the less treatment you'll have to have if you find it early.
So how often are you supposed to get a mammogram then, and how early in life?
Right. For every normal lady, you should start screening, every woman should start screening at age 40. If she has a family history of breast cancer, you want to start screening 10 years prior to the age that your relative was diagnosed.
Yeah.
If you have problems in your breast, if you notice lumps or bumps, you always want to have that checked. It's better to have any lump checked by a clinician rather than just assume it's not anything.
Yeah.
And just because we can't, emphasize this enough, how important is early detection?
Early detection is key. Early detection, you can, instead of having to have chemotherapy, you can avoid chemotherapy. You may be able to treat it surgically without any other intervention. It will help prevent the comorbid illnesses.
Well, and I was going to say self-breast exams are probably a big part of this too. I mean, how often should women be doing those?
Right, self-breast exams, the big key now is to, what many of the Komen Foundation is pushing is know your breast tissue. Monthly exams are still very important, monthly self-exams, and just know what your breast tissue feels like.
When things are,
But it's not just women, right? Do men also, is it possible to get breast cancer as a man?
Yes, men do get breast cancer. In fact, here in our community, we've had several men that have been diagnosed in the last year. Wow. So it's important to know that if you've got an abnormality, it needs to be checked.
And I want to mention this, a few months you came back and talked about Thrive. It's this boutique you have for people affected by breast cancer. Kind of remind us what that is.
Yes, ma'am. It is what we call a survivor's boutique. And it is a place that we have that ladies can come in and get bras, prosthesis, surgical camisoles, just if you've survived breast cancer.
Yeah, and this is in the hospital, correct? Or where is it at?
It's actually in the North Park building behind the CHRISTUS Mother Francis main hospital in the North Park building on Houston Street.
So where can women or men find information about these services that y'all offer?
You can go to our website for the Ross Breast Center. There's also great information at the Komen East Central Texas. That website and the American Cancer Society website has got great information on breast cancer and breast cancer screening and prevention.
Okay, thank you so much. Appreciate it.
Thank you.
Okay, we'll be back with more of KETK's